Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and today we are going to talk about skin cancer, melanoma. Skin cancer is the most common type of cancer in the human body. And there are a variety of type of skin cancers like squamous cell carcinoma, basal cell carcinoma, and melanoma is one of those different type of skin cancers. Melanoma constitutes less than 1% of the skin cancers. However, melanoma is the most fatal type of skin cancers one can have. It is expected that in 2016 there will be about 85,000 new patients of melanoma, out of which 21,000 will die due to melanoma. Incidence of melanoma is rising every year in last 30 years, and many more patients are being detected with melanoma. So today we are going to talk about melanoma, the most fatal type of skin cancers, and with us is Dr. Sanjay Azad. Welcome, Dr. Azad, for the show.
Thank you.
Dr. Azad is a plastic surgeon at Thunder Bay Regional Health Science Center, and we're very happy to have him here. Dr. Azad, in my practice and in your practice, we see a lot of cases of melanoma every year, especially in the summertime. Please tell us who gets this melanoma skin cancer? What are the risk factors for melanoma?
Well, I see it in all ages. There's no age which is exempt, but dominantly the melanoma tends to be seen in slightly older individuals.
Old, you mean after 50?
After 50. It is more often seen in men as compared to women, and also patients who've had some medical problems, like who are on medication for transplantation. Their immunity is low, and these are patients who will develop this condition more frequently as compared to the normal population. But to be honest, my patient contact is with patients who had none of these problems and come with a dark lesion, right. And then they investigate it, and then we find it to be a melanoma.
Do you think the skin being exposed to ultraviolet radiation is a risk factor? Why do we see more and more patients of melanoma? Is that ultraviolet radiations are causing damage and leading to melanoma? Is that
I think certainly the ultraviolet radiation is thought to be one of the key factors, and a lot of people like to worship the sun.
Yeah. So
they're exposing themselves more and more to sunbath. And what I've seen is that patients who come to me who are in the 50s or 60s, they've been exposed to sun a lot in the younger days. So that has accumulated, and the sun has probably potentially created damage, and then they've developed melanoma.
So sun has variety of rays, and one of those type of rays is ultraviolet radiations probably, and those radiations may cause damage to the DNA of the skin, especially melanocytes, and then that leads to melanoma. But ultraviolet radiation can cause other type of skin cancers also, like squamous cell or basal cell carcinomas also.
Correct. So it is thought to be one of the main factors in all sorts of skin cancers.
Ultraviolet radiations. Do you think the people go to tanning salons is a risk factor for melanoma?
Definitely. I mean, that is been shown by more recent studies, and the recommendations now are to avoid tanning salons as far as possible, because people want to look a bit browner, and they feel that they look healthier.
Want to look like me.
Yes, and like me. So I think that's one of the things that more and more people should be aware of, that going to tanning salons is not a good thing. They can do a spray-on tan, which is much safer and which avoids the effects of damaging your skin.
Do you think the pre-existing pigmented lesions like moles people have on their all over, everybody of us have one or other type of mole. So what are the chances that a mole can become a melanoma?
It is generally very rare for a mole itself to become a melanoma, though there are, some people have a lot of moles on their body, and then they got to be more aware of it. So if a mole is changing, and there are some situations where we may have to consider that the melanoma is developing. But largely speaking, a mole by itself is completely harmless and is common, and should not be a bother.
They say that there are congenital moles, and then which are called congenital nevi, and there are dysplastic nevi. So are those nevi or the moles risk factors for developing melanoma?
Yes, potentially. So if you got a very large mole on the body, which has happened from birth, or there is a mole which is looking slightly larger or changing in color or shape and size, then those potentially could lead to melanoma. And you've got to be more aware of your skin for that.
So any pigmented lesion, when it is sent to us to pathology lab for the biopsy, and we say it is a dysplastic nevus, which means that it has a high chance of probability of being converted to melanoma. And similarly, the children which are getting pigmented lesions in the young age called congenital nevi, so they can also get converted if they are big in size, right? So for the large lesion in the children, we should watch them carefully and follow up. Do you excise all the moles, or there are certain moles you excise and you don't excise?
Well, it's a good question. And the answer is there's no such sort of recommendation that all moles should be excised, because if you start doing that, then you would be excising everybody with every pigmented mole.
Right.
So then the mole which should be excised is the one which is suspicious, and normally speaking, for any mole, following them through with photography or regular observation with your family doctor or a dermatologist or a plastic surgeon is a good thing to make sure that there's no changes which may signify that there is a melanoma developing.
So not all the moles or all the pigmented dark lesions should be removed from our body. Only the lesions which we think are growing very large or they are changing their color, then we go to the doctor, and doctor may decide, a plastic surgeon like you or dermatologist may decide whether to remove or not.
Absolutely. So you've got to be selective, and moles are there for everybody and they're harmless.
Thank you, Dr. Azad. We'll take a short break and we'll come back and we'll talk more about melanoma. Thank you.
You're welcome.
Welcome back to the show, Talk with Your Doc. Today with me is Dr. Sanjay Azad, and we are talking about malignant skin cancer, which is melanoma. We just talked about what are the risk factors for the melanoma, and as you mentioned that anybody in any age can get the melanoma, but people in the older age tend to get melanoma. We talked about ultraviolet radiation causing a risk factor for the melanoma, and tanning saloon can be a risk factor for developing melanoma. Can you please tell us about the people with the skin color, people especially Caucasians, white people, what is the incidence of melanoma in them?
So the darker skin is more protective, and if you're fairer skin color and you tend to burn easily rather than tan, then you're more prone to developing this condition. So it's important that fair-skinned people look after their skin because just the nature of the skin itself.
So after 50 years, white people more exposed to ultraviolet radiation or sun rays, all these are risk factors for melanoma. So how can we prevent development of melanoma? What precautions one should take so that this bad type of skin cancer is not found in oneself?
So I think there are two main areas which would help in this. One is being aware of the sun, and the second is being aware of your skin.
Right.
So the sun awareness is, we know that sun is is something which we all desire, but it's not really good for your skin. So exposing your skin for too long or getting burnt is not a good idea. So the application of sunscreen, at least factor 30, is a good thing. And if you're going into water, then you must follow the recommendations for applying sunscreen more frequently, virtually every 2 hours. Before you leave the house, apply it half an hour before, and then make sure you cover all exposed areas. And some areas which are not exposed, which are not covered by sunscreen typically, are sort of the areas, particularly the hands, the neckline, and sometimes the feet. So these areas, people will cover the face, but not those areas. So make sure that you have sunscreen application on that. Then put on a large hat. Cover your arms with sleeves, and basically be sensible in exposing yourself to sun and avoiding a sunburn.
So sunscreen lotion, protecting yourself against the ultraviolet radiation of the sun, which is very important. Now, melanoma can also develop in the eyes. And what would you like to say about precautions for developing of melanoma in the eyes?
But you can wear protective sunglasses, which are UV stable. So that would be something for you to consider, and yeah, that would be helpful as well.
Right, and finding the melanoma in the children, what sort of precautions one should take?
So for children, again, making sure they have sunscreen on. If they are going out into water, then there are sun protective swimsuits available. Looking at that, reapplication of sunscreen on a frequent basis, especially if they're getting wet. And as the child grows up, making them aware that sun exposure is good in one way, but they shouldn't get sunburnt.
Yes, yes. Now, is there any role of family history? Somebody's family has a melanoma. What are the chances that we can get a melanoma?
Yeah, so there is there are genetic traits and mutations which can happen. So if there is a family history of melanoma, then certainly there is a higher chance of you developing melanoma. So being more aware of it.
Right.
And what I've seen is that generally people who've got melanoma in their family are much more skin aware, and they come forward much earlier.
Right.
So that's all a good thing.
So one having a family history or having multiple pigmented lesions, brown or dark colored lesions on the body, one should be extra cautious and avoid this risk factors. Otherwise, chances of developing melanoma are higher.
Absolutely. So basically being very aware, much more aware of your skin.
Right.
Because this was not something which was highlighted maybe 30, 40, 50 years ago.
Yes.
But now it is becoming more and more common to see this condition.
Right.
And I think everybody should look after their skin in every possible way.
Right. Now, how one can detect melanoma at early stage? What are the signs and symptoms? How one can diagnose it and make it sure that it is detected and treated at early stage? So what precautions one should take?
So you're basically looking at any skin lesion, and we normally call it the A, B, C, D, E. So A stands for asymmetry. So it means that any lesion which is looking different, if you draw a line through it, it looks different on each side. So that is it's asymmetrical. If the border is getting irregular of that particular lesion, then that is also suspicious. If the color is changing, so let's say you've got dark and lighter areas in any skin lesion, then that is also suggestive that it could be a melanoma. And if it's increasing in size, let's say it is going beyond sort of 5-6 millimeters in diameter, then that is also suggestive that, look, this could be possibly a melanoma. And if it's evolving a lot, so it's changing, it bleeds or itches, those could be additional signs as well.
So one should self-examine himself or herself regularly and look for any pigmented lesion having these features what you just mentioned, that asymmetrical lesion, irregular borders, changing the color, or increase the dimension of the lesion. All of a sudden the pigmented lesion changes its size, or there is an enlargement of the lesion, then one should approach a doctor. Is that right, what you're saying?
Correct. So just basically being aware of your skin and examining yourself with good light at home, getting your friend or family to help you on areas which are not accessible, like the back.
Right.
And then looking at it and then moving forward from there. And if you feel that anything is in this category which you don't like or looks suspicious, then please approach your doctor straight away. Right. And then an appropriate referral will be made for the patient, for you.
So the mole, which is a benign or a good type of pigmented lesion, and the melanoma, which is a bad type of pigmented lesion. So what will be the characteristics of a good type of pigmented or mole? How does it look like?
So mole, the color can be brown or tan colored, or even sometimes is darker, but the borders are very, very irregular. The color is very similar throughout the mole. There's no bleeding or itching in the mole, and it's not changing.
Right.
So it just remains static. So if you got a mole, if you got any lesion which has got those sort of characteristics, then you know that, look, this is probably just a benign condition. But do not wait. If you got any doubts,
Right.
get it checked out.
So mole is a small lesion, like say 6 millimeter or less?
Yes, so they can be in different sizes. I mean,
Okay.
these dimensions have been given so that it focuses attention on
Right.
an area. But any lesion which you think is small and is not evolving, then it is probably a benign condition.
Go to the dermatologist or to your family doctor and get it evaluated.
Correct.
If the lesion is looking irregular or becoming bigger in size.
Absolutely.
Thank you so much. Please stay back and we'll come back to the discussion after a short break. Welcome back to the show, Talk with Your Doc. And with me is Dr. Sanjay Azad, and we are talking about melanoma. We just talked about how can we diagnose melanoma at earlier stage by doing regular self-examination, noting the change in the dimensions of a pigmented lesion on your body, if it increases in size or color. And I, as a patient, come to you. So what do you do the next once you find a lesion is abnormal?
Well, you go through a full consult and check on the patient's medical history and allergies and any medications which can affect the treatment. So once you've evaluated the patient fully in a clinical sense, then the next step is to typically look at the lesion, and it looks suspicious, then we want to do a biopsy.
Mm-hmm.
So for a dark pigmented lesion, more often than not, you want to take the whole lesion out if possible. Let's say the lesion is very big,
Mm-hmm.
then you may have to just take small little pieces from different areas.
So that is to diagnose it just.
There's just a diagnostic biopsy,
Okay.
and you only take a very little amount of skin all around it, and you send it off for evaluation.
Right. So that is called excisional biopsy or punch biopsy also you might send. How about lymph nodes? Do you ever evaluate the lymph node biopsies?
So lymph node biopsy is a more recent thing. It is becoming more and more common depending on the melanoma itself and the stage of the disease.
Mm-hmm.
But the lymph node may have to be biopsied, but it is typically done by injecting some kind of locator dye to find the lymph node which may be involved.
So that you call it as a sentinel lymph node biopsy probably?
Correct.
Right. Not all the patients get sentinel lymph node biopsy probably, right?
No, so it depends. So when patients come to me, I do the excisional biopsy or do the treatment for them,
Mm-hmm.
and then send them to the cancer center, and then they will be evaluated, and then only for the very specific patients who are in a more advanced stage will they require a sentinel lymph node biopsy.
So once you take a biopsy, then biopsy will come to a pathologist like myself at the hospital, and then we evaluate the biopsy. We diagnose whether it is a melanoma or not, and if it is a melanoma, then we'll say what type of melanoma it is. We will measure the depth of the melanoma, the thickness of the melanoma, and we stage the melanoma depending upon the stage, the mitotic index, the ulceration, and all other parameters. So can you please tell us about what other staging investigations do you do in addition to the pathology report?
So apart from the biopsy itself, you can do some blood tests. Particularly, you can do some liver tests, which may suggest that the disease is more advanced,
Mm-hmm.
and of course we can do scans.
Okay, radiological investigation. So
Correct.
chest X-ray, PET scan, or MRI,
Absolutely.
or sometimes you do CT scan guided biopsies also of the lymph nodes, and you evaluate whether the lymph nodes or the metastatic organ has been involved by the malignant tumor, and then you stage the whole melanoma. Now, once the staging is done, what are the survival chances or survival statistics for different stages like stage 1, 2, 3, 4 melanoma? So this TNM staging, so what are the survival rates?
So if the melanoma is very early, let's say the melanoma has not gone beyond the very top layers of the skin, and that's called a melanoma in situ.
Right.
So in that situation, there's no problem with survival at all. The survival is normal.
It's a curable.
It's a curable condition for sure.
Right.
Then if it's, let's say a patient is being diagnosed with all evaluation as stage 1, then you're looking at about 90% survival plus, for 5 years.
5 years.
then it goes down as you go down to stage 2 and stage 3.
Mhm.
Stage 4, of course, is a more advanced condition which is spread to other organs, and then the survival is very poor.
So stage in situ melanoma is curable. Stage 1 has or 2 has a good survival, and as you go towards stage 3 or 4, then the 5-year survival is less.
Yes.
So what are the treatment options for stage 1, 2 or earlier stage of melanoma, and what are the treatment options for late stage of melanoma?
So the primary treatment of the melanoma is surgery.
Okay,
And
all the melanomas are treated with the surgery.
Surgery, and then there are other treatments for any sort of cancer,
Yeah.
which rest on things like medications, chemotherapy, or radiation treatment,
Yeah.
and there are some other experimental treatments
Right.
with vaccines.
So for the surgery, please tell us about what are the different types of surgeries you do in the melanoma case.
So for a melanoma, let's say the melanoma is an early melanoma, there are some described margins of removal. So when you've had a biopsy, only a very small area of tissue is taken out. But when you do a formal treatment for a melanoma, you remove more skin around the tumor. So you want to go deeper as well as on the side. So what you do is what we call as a wide excision of the tumor. So you remove it completely, and then once you've done that, then some form of reconstruction is required for the area because the removal is quite large. So then you have to do either local flaps, which is like tissues are mobilized to close the big area, or we can use skin grafts.
So you remove the tumor, which is a pigmented cancer melanoma, with normal skin tissue around it,
Correct.
making sure it is completely excised and it does not come back.
Absolutely. So that's those treatments have been described through lots and lots of studies which have been done over the years, and you basically follow the guidelines and then remove the tumor accordingly.
Right. Now, you mentioned about other options. So surgery is the common treatment for all, and then there are other options like radiation you mentioned, and then there possibility of immunotherapy or targeted therapy also. So do you use the radiations for all the patients or for certain patients?
So no, they're not used for all the patients, but they'll be only based on specific patients, specific criteria, and this is all discussed in an environment of the cancer center. And we've got a big cancer center in Ontario at Thunder Bay Regional, and then it's discussed with all the specialists present, and a decision made whether it's appropriate for the patient or not.
Right.
So with all the medical history and the melanoma, along with any lymph glands involvement, all those things are taken into account as well.
So there are new advances in the treatment like immunotherapy. These are the treatments which increase the immunity of the patient to fight against the cancer cells. And there are new treatments like targeted therapy, which are different than the chemotherapy, where in the targeted therapy, they do the testing for BRAF mutation study, and this targeted drugs are targeted towards those patients with this BRAF mutation positive patients. So all those increase the survival of the patients with the cancer, and the survival chances of the patients even in the late stage has been improved with the new updates in the treatment. Do you want to add anything to that?
Yeah, I mean, certainly there's a lot of research going on because melanoma has been a big bugbear for us. So all these new therapies are coming in. They still need to be evaluated fully,
Right.
and the response rates are improving, and we've just got to bide our time and see how things fare out.
Thank you, Dr. Azad. That's very helpful. Thank you for your time. Thank you, viewers, for watching the show Talk with Your Doc. Please join us for the next show where we are going to talk about cervical cancer. Thank you.